This is Nursing Shortage by Miranda Nicholson. What is a nursing shortage? Nurses make up the largest section of the health profession. There are approximately 29 million nurses and midwives globally according to the World Health Statistics Report. The American Nurses Association, or ANA, predict more registered nurse jobs will be available through 2022 than any other profession in the United States. 11 million additional nurses are needed to avoid a further shortage, which is projected by the U.S. Bureau of Labor Statistics. Nurse employment opportunities are expected to grow at a 15% rate from 2016 through 2026. This is faster than all other occupations. And this little thing over here says nursing is among the fastest growing occupations in the U.S., but the country still faces a large shortfall of qualified nurses. The shortage will continue to be increasingly important due to our aging population, a lack of nursing educators, and high turnover in the profession. Nursing shortage as a global issue. There is a shortage of 7.2 million healthcare workers according to the World Health Organization, or the WHO. The increasing gap in the supply and demand of nurses has triggered a global problem. The nursing deficit will reach 12.9 million according to Third Global Forum on Human Resources for Health. Canada will suffer from a 60,000 nurse shortage in 2022, which is estimated by the Canadian Nurses Association, or CNA. So what do the numbers look like? The RN workforce is expected to grow from 3 million in 2019 to 3.3 million in 2029. This is an increase of 221,900 according to the Bureau of Labor Statistics. The Bureau of Labor Statistics also predicts 175,900 openings for RNs each year through 2029. Many reports project that 1.2 million new RNs will be needed by 2030 to address the current shortage. And this down here shows that registered nurse shortages by state and how they are projected. So it is showing the difference between supply and demand expected by 2030. So these are the most severe shortages. As you can see, California ranks number 1, Texas number 2, New Jersey, South Carolina, Alaska, Georgia, South Dakota, Montana, North Dakota, and New Hampshire. They're all the top 10. So if you look at California, the difference between the supply and the demand, they're estimating it's going to be 44,500 in the negative. So that just kind of gives you a little outlook for what we're looking at. So what are the causes of the nursing shortage? Aging population. The baby boom generation is entering the age of increased need for health services. In 2020, the United States had the highest number of Americans over the age of 65 than any other time in history. The last of the baby boomer generation will reach retirement age in 2029. The need for health services increases as the population age increases. Aging workforce. The nursing workforce is aging and will be retiring. In 2020, there were approximately 1 million RNs older than 50 years. This means that 1/3 of the nursing workforce could be at a retirement age in the next 10 to 15 years. Nursing burnout. The national average for turnover rates in 2020 was 8.8% to 37%, depending on the geographic location and nursing specialty. Some nurses leave the profession early after graduating and deciding that this is not the profession they want, and some work for a while and then experience burnout and leave the profession. Some other causes of nursing shortages: career and family. The majority of people in nursing are females that are often during childbearing years. Females tend to cut back or leave the profession altogether while childbearing. So depending on the region, some areas struggle to fulfill the local population's basic needs as a whole, and some regions seem to have a surplus of nurses. Certain specialties of nursing may also have a higher shortage. Growth. So the West and Mountain regions are projected to have the fastest growth potential, and the Midwest and Northeast are projected to have the slower growth potentials. Areas with high retirement populations are seen as areas with higher needs. Every state is projected to have at least an 11% growth through 2022. Some more causes of the nursing shortage include violence in the healthcare setting. Healthcare staff tend to experience emotional or physical abuse. Emergency department and psychiatric nurses are at a higher risk of violence due to their patient population. It is often common for inpatient nurses to suffer from violence more than outpatient setting nurses. 8 to 38% suffer from some form of violence in their career. COVID. The pandemic has also had an influence on the nursing shortage. Nurses are on the front lines and are experiencing more chaos, grief, and loss. The demands of the care of COVID patients can be felt across the healthcare landscape. There are very competitive wages being seen and COVID vaccine mandates being pushed that are causing changes in employment. Horizontal violence is intergroup conflict that is manifested in overt and covert non-physical hostilities such as sabotaging, infighting, scapegoating, and bickering. Bullying is just another term for horizontal violence. There are frequent unit conflicts, presence of cliques, and lack of managerial support were reasons of consideration to leave their nursing position. I'm sure we've all heard of nurses eat their young, and I've experienced it myself, and I'm sure many of you have as well. So what has been done to address the nursing shortage? Many states are addressing the shortage of RNs and nurse educators. The University of Wisconsin announced the $3.2 million Nurses for Wisconsin initiative in 2014. This provided fellowships and loan forgiveness for future nurses, faculty who agree to teach in the state after graduation. Nursing schools are forming strategic partnerships. The University of Minnesota announced a partnership with the Minnesota VA healthcare system in 2013 to expand the school's enrollment in the school's BSN program. The VA committed $5.3 million to the university to expand clinical placement sites, fund additional faculty, and support interprofessional engagement. Telehealth and remote patient monitoring is helping to find an immediate solution for the healthcare shortage. This allows for less travel time for nurses, reduced costs of care delivery, more timely access to care, and improved communication capability between nurses and patients with talk. So what are some strategies to fight the nursing shortage? Creating a healthy work environment is essential. One that empowers and motivates nurses to rejuvenate and sustain the nursing workforce. Empowerment and autonomy in staffing ratio decisions, considering high volume and acuity levels, will lead to less burnout and strong desire to leave the workforce. Of course, increased wages help as well, and retention bonuses have been present in this last year. Greater access to education. Creating programs that incentivize students to enroll in nursing school, complete their studies, and continue their education to uplevel their skills and careers is one strategy for increasing enrollments. Flexible options for schooling, such as online programs, are also critical to recruiting and retaining engaged students. Strategic workplace accommodations and flexibility. Empower nurses to create their own schedules and reward senior nursing staff for mentoring new nurses. Increased opportunities for career development and growth in nursing will help maintain nurses. So, in summary, the nursing shortage has been an issue for many years and will probably continue to be an issue globally. Causes for the nursing shortage are aging population, aging workforce, nurse burnout, career and family, regions, growth, workplace violence, and COVID. Things have already been done to help fight the nursing shortage. There will need to be more strategies to fight the nursing shortage in the present and future. And these are my references. Thank you.